Mark MacDonald, followed by Beatrice Wishart.
Thank you, Presiding Officer. Can I begin by paying credit to Willie Ryan and the Liberal Democrats, because it's often the case when opposition parties use their debating time, they choose to split it between two subjects, and that often can lead to debates which can be truncated and can often feel rushed. So I pay tribute to the fact that the Liberal Democrats are spending their entire time debating what I think is an exceptionally important issue today, because it should allow for some deeper analysis of a very important subject. In terms of the debate that we've heard so far, I think that one of the difficulties I often feel is that the term crisis is used often in our public debate and often misused in our public debate. And there is no getting away from the fact that there are significant and serious issues within our society in relation to mental health and well-being. But it would also be fair to say that there is progress being made. At the most recent NHS Grampian briefing for MSPs and MPs, we were told by Lynn Taylor, the Clinical Director for CAMS in the North East, that now 91% of Aberdeen City and Shire patients are waiting less than 18 weeks to be treated. There are still some issues in the Murray area, but in the City and Shire it's now 91% being seen within that 18-week period. But also, and Mary Fee raised the issue about rejection of referrals, we were also told that while it is true to look on paper and see 23% of rejected referrals, only 4% of those rejections relate to a failure to meet the CAMS criteria. Often it can be about the age of the patient who has been referred, or it can be about the fact that they are seeking advice rather than treatment, and that leads to a rejection in terms of CAMS treatment. So it's often worthwhile. Well, I've got a lot to get through, so if it's going to be brief, then absolutely. But what I would say is that there's often a lot that sits below the headline statistic in these issues. That's not to take away from the need to tackle issues, but I think it's important we do understand what sits below those headline statistics. I'll take a brief intervention.
Monica Lennon.
I'm grateful and I agree with the member about the need for that deeper analysis, but one of the statistics which really alarms me is the 160% increase in suicide by those under 18 since 2014, between 14 and 18. What does the member say about that?
Mark MacDonald.
Well, I was literally just about to come on to the issue of suicide and discuss that in perhaps a slightly wider context than just young people. But one suicide is a tragedy, let alone the numbers which we see in Scotland on an annual basis. And recently we had the opportunity as MSPs to undertake suicide prevention training, which was provided by SAMH. I attended a session with Liam MacArthur and also with Finlay Carson. And at that session, one of the key things which came across when we were talking about people who may get in touch with us as MSPs or may reach out to us personally was that often the vast majority of people, they don't actually want to kill themselves, but they get to the stage where they are unable to find anybody or to reach out to anybody who is able to convince them that that is not the correct way to go. And that, I think, in terms of what Monica Lennon is saying, I think that highlights the need for us not just to focus on places like CAMS and those, what I would describe as the points at which people are in the state of crisis, but needs us to take that step back and look at the early interventions that are necessary and where those early interventions are best placed. I think Jenny Goruth made some very important points around that, about how education can, for example, as a service, be more attuned to the needs of young people. But also we need to think about peer and community support. And I'll just highlight two examples from within the northeast of Scotland. And Brian Whittle mentioned those community charities or voluntary organisations. Aberdeen Man Chat was established in June of this year by a local stand-up comedian, Ray Thompson, as a means to encourage men, and we've heard the statistics in relation to men and suicide and the issues that Jenny Goruth highlighted about men being more likely to close up in relation to their mental health and well-being. It was designed as a means to encourage more men in the North East to be open about their mental health and well-being, but to do so in a more supportive environment and not feel potentially the stigma of coming into contact with statutory services. It has grown exponentially in terms of the numbers of men who are getting in touch with the organisation, and it is really having a positive impact and a positive benefit for the men who are attending the meetings that take place. Perhaps at the other end of the age spectrum from what Monica Lennon was talking about, the positive impact of men's sheds cannot be underestimated in terms of tackling isolation and loneliness, which can often feed mental ill health in relation to older men. These are both examples of community support which, as well as helping people, also are going to be in a position to require funding in order to be able to deliver that. And my question, I suppose, would be how we ensure funding filters down to these organisations rather than simply being about how much money we spend on statutory services, which are often not the first point of contact for many people who are affected by mental ill health. With that in mind, I would also say in terms of the physical health debate, physical health complements mental health, and I've seen this firsthand in terms of my own involvement with Jog Scotland. I'm a member of a Jog Scotland group in Bridge of Dawn in my constituency, and for my own mental health and well-being, there are days where I've gone along to my Jog Scotland group, and simply that companionship, camaraderie, conversation that takes place during the jog round can be uplifting and can help get through a day when you felt like you didn't even want to get out of bed in the first place. But finally, Presiding Officer, and this is very much finally, in terms of the point Alison Johnson made about initiating conversations, we also need to think very carefully and reflect very carefully about the type of society we are creating for our children and young people to grow up in, both in terms of social media, which has been well rehearsed in debates, but also in terms of traditional media. When we have one of the main breakfast programmes in our country being fronted by a man who will mock men for being open about their emotions and talk about people's needs to man up. And when we have magazines which will bombard women with negative messages about their body image, either being too thin or being too fat, we have to ask ourselves about the impact that has on young people who are subjected to these messages on a daily basis and their mental resilience, Presiding Officer.